Welcome to this ASN Kidney 360 podcast. I am Cecile Hermans from the Division of Nephrology and Hypertension, Department of Internal Medicine at the University of Kansas Medical Center. Today, I'll be discussing our study published in Kidney 360 titled A Prospective Study of Depression and Quality of Life After Kidney Transplantation. Our study assesses changes in depression and health-related quality of life after kidney transplantation. It is a longitudinal observational cohort study where we enrolled patients from the kidney transplant waitlist and followed them after transplantation. We assessed depression and quality of life prior to transplantation, and then again at 3 months after kidney transplantation, and finally 1 year after kidney transplantation. We had the 1-year follow-up to see if initial changes at 3 months were sustained beyond the immediate post-transplant period. We also assessed if there are any patient characteristics, such as age, that affect change in depression and quality of life. We used the BDI, or Beck Depression Inventory, to evaluate depression, and the HRQOL, or Kidney Disease Quality of Life short form, to evaluate health-related quality of life. The HRQOL scoring was further divided into the physical health component score and the mental health component score. We use linear mixed effect models with random intercepts for patients to evaluate the effect of age and kidney transplant status on depression and quality of life scores. The key findings of our study are that patients experience improvement in depression and health-related quality of life after kidney transplantation, which is sustained for at least 1 year post-transplant. However, we found that the improvement in physical health component of HRQOL was greater for patients less than 60 years when compared to those over 60 years of age. The magnitude of improvement in both physical and mental health components of health-related quality of life were less for older patients. The limitations of our study are that it is a single-center study, which may affect the generalizability of our study. While kidney transplant will remain the treatment of choice for those with kidney failure, we believe this study will help frame the expectations patients have for their clinical course post-transplant, especially elderly patients who may not see a significant improvement in physical function. Our findings should also help transplant centers with the difficult task of estimating the benefit of a kidney transplant to justify the risks of major surgery. Thank you for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.